Trial.
Be, itu suka
Trial.
kenapa tuh ya?
Halo.
Be. Be.
Trial.
Tuh, dari tempat lu suka ada trial gitu.
Halo, halo. Can you hear me?
Trial.
Iya, gue bisa dengar. Bisa dengar suara gue?
Yes, very clearly.
Yeah, but your voice is echo. And then in another from another account is always sound woman voice. I don't know.
Trial.
Okay.
Trial.
Ya, nanti gue dipresentasin ya.
Yeah.
Trial. Trial.
Yang ini nih
Trial.
Beh, yang punya lu yang satu lagi nih, ada suara-suaranya terus.
Trial.
Yang mana? Oke. Sekarang.
Bukan yang ini. Nah, itu.
Udah, masih.
Nah, ya kayak gitu.
Lagi nyanyi dia.
Mungkin karena lagi cek itu kali, Bu, speaker. Ada yang lagi tes speaker nggak?
Udah kan?
Calvin.
Hello.
I cannot hear your voice. Okay, I hear now.
I'm having some
Thank you for
difficulty.
joining us.
For my angle, I cannot find my angle, Tia.
You're already in YouTube now, streaming.
Oh, hello, everyone. Hello.
You're very handsome now and a little bit big. Why is it?
Don't asking that.
You're not so polite.
Yeah. You know that by Kunisang getting like
Yeah,
thinner.
it is. It's thinner. I'm happy. Yeah. I don't know how to angle myself like this, my cheek.
Already handsome at any angle.
Anyway, yeah. You have multiple profiles by Kuni.
Yeah.
So, my presentation is about 30 minutes.
Yeah, because you have so many slides, but it's okay.
Yeah, I practice.
Just cut the Baikunisang proportion.
I practice, don't worry. It will be 25 minutes by that time. Yeah, at least. I'm nervous.
Anyway, I'm very glad to see you again.
Same here.
In Manila, still lockdown now?
Huh?
Still lockdown or?
Modified enhanced community quarantine, Tia.
Oh.
Yeah.
We have in Indonesia, we have like large scale social restriction. It's like kind of like a modify of like a lockdown.
Tia, can I also make use of this link to invite Professor Crisostomo? Professor Marilyn? The link that you gave me?
Yeah, the link with the meeting ID and what the password. You
In the
can
email?
no in Messenger.
Messenger. Messenger. Could you send it to me again? I'm sorry, I have to look for it. Comment, eh?
It's okay. I can send you.
Ah, the password. Okay, okay, okay. Wakara, wakara. How are you, Chairman Baikuni?
No. Kelvin, I'm very glad that Sensei will come to join us. It is true? Is it true?
Yes, he said yes, he will be around. So, tabon, it should be fine. Crisostomo. Yeah. I just hoped I will do justice to my country's country report. I'm not so sure if I did well in preparing.
I'm also, but I think this is like an informal speech, something like that.
Yeah.
Informal.
Not
Yeah.
So
so
you,
seriously.
No.
Tia will song for us.
I'm not wearing pants.
I will dance with Dr. Shafi maybe.
Who is this? Perhaps somebody wants to enter. Kana? Hello, is it already? Ella Laila.
Oh,
Not yet, not yet. We're sorry.
not yet.
I'm looking if there are other participants.
This is Professor Maru. Please invite Professor Maru, maybe.
We,
Here, already here.
oh, really?
I can. Yes.
Villa.
Yeah.
I am now attending Maru. Okay.
Ada Profesor Maru nggak di sini?
Ada.
Mm,
Can you?
yes.
Yes.
I see.
Yeah, she's in
Wait.
the webinar chat.
Done.
Hello, Professor Maru. Nice you can join us today.
Okay, thank you.
Hello, Maru Sensei.
Hello.
Thank you for joining this webinar.
Konnichiwa.
How about Japan now?
Say,
Everybody still in home in Japan?
Yes. Konan Women's University is now self-quarantine. So we are broadcasting our lecture from our home to the and students are also staying in their homes. But we hope it can be lifted to the level maybe in the next week. So thank you. I'm going to off my video.
Okay, thank you.
Okay.
let's see if the others are coming. Dr. Shafi will come soon.
Yes.
Yeah. He already wake up. Just wake up in the
Because
middle
we
of
are
night.
in the middle of the night.
Yeah. Thank you for this initiative, Tia and Baikuni.
No.
Really,
I just want to see you after a long time.
So the plan is after you invite me, I will invite you.
Oh, good.
Tia is not smiling anymore.
No, I'm answering the.
No problem. Okay.
How many person can we invite in this yeah? It is still 10 or more than 10?
I don't know. Maybe you can ask the Villa. Villa?
Yeah, is
It can be more 10%, sir.
Okay. So if another professor comes, so please add to the time.
Yeah. Yes, please tell me.
This is Kaori Mizumoto. Ready?
Miss Moto-san.
Mizumoto-san, Kaori
Yes.
Mizumoto.
Please add Mizumoto-san. I think
So Tia, this will be recorded in YouTube.
Already
Yeah.
streamed in YouTube.
Okay. So
YouTube.
it will be recorded, ne?
Yeah.
So we can send it as a link. Okay, perfect.
You can share the link YouTube later.
Agustin Sensei is joining us. Agustin Sensei.
I already remind her. Actually, she's very busy, so he will have another meeting after this, but that's okay, I will join.
Some of the participants, Dr. Anke told me that some of them won't be able to join. So they wanted a video. Hello, Mizumoto-san.
Hello.
Hello.
This is not. It's not me. It's me, but it's a photo of 10 years ago.
No
It's okay.
difference. It's okay.
It's still very beautiful.
Can you see my face now?
Not yet. Probably.
I'm watching you. I'm watching your faces, but you cannot see me.
No, not yet. We can see the
The
photo.
profile picture.
It's no. Well, okay. Video. Yes.
Right. Yay!
Very dark. How? Okay.
Perhaps against the hello.
Hello. It is in your office?
Yes, my office at university.
Wow.
Thank you in your busy
Thank you
time.
for coming.
It's okay. Wait. I changed my.
So I'm waiting to be a professor like you.
Yeah.
It's okay. Yeah, I still have time.
You.
Calvin, how are you? Good.
Can you see this? Ampaman.
It's good. I also want, no. I want to gain my weight because otherwise I just gain my wrinkles.
I will give it to you now.
Yeah, I will get your fat around my eyes, then stretch my wrinkles.
Yeah, even Nakamura Sensei, when I met him in January, he was telling me, Calvin-san, for the conference, please try to slim down.
Pak Kemal udah ada.
Yeah. Kemal, Villa, please.
Yeah.
This Professor Kemal from Indonesia will join us.
Okay.
So,
Bu Fajar, masukin aja tuh Bu Fajar.
ada Bu Fajar.
Yeah.
I think, Baikuni-san, you lost your weight.
Yeah,
I slimming
many.
on
I
diet?
think, yeah, like that. Hello, Professor Kemal. How are you?
Hello.
Hello.
Good afternoon.
Yeah, Professor Kemal is from University of Indonesia. He's the rector of IAKMI University.
Cyber University.
Oh.
So we have Indonesian Public Health Association.
He is also my teacher.
Oh, nice to meet you, sir.
Long time ago.
Oh, I can see Dr. Fajar today.
Yeah, Doctor.
Dr. Fajar, could you show your face? Everybody missing you.
Professor Maru missing you so much, Dr. Fajar.
Oh, really?
You can show us the baby.
Oh, yeah, okay. I will show my baby.
I want to see your baby, newborn.
Yeah, newborn just maybe six months ago.
Wow.
The fifth.
水本先生、はじめまして、江南女子大の丸と申します。
はじめまして、水本です。よろしくお願いします。
Yeah.
Oh, cute.
Cute boy. Calvin, he looks like your brother. See?
Nice color. Chubby cheeks.
Yeah. So cute. Wow.
I'm not able to bring my third one.
Yeah, your son.
Profesor Kemal, I think.
Noisy.
Tuh ada Pak Kemal tuh.
Ada Eyang.
Eyang.
Hello. So long time. How are you, Dr. Fajar?
Fine, thank you. How about you?
Yeah, I'm fine. I'm fine. I feel really sorry about our research. Maybe I will write to you later.
It's okay. We will discuss later.
Professor Mizumoto, I just wondering how could you can go to your university? I think that everybody there is still locked down, something like that, in Japan.
Sorry,
How you can come to your office? Everybody's still in your office. I think you students, something like that.
Yes, this week we started. Yes, we resumed our classes this week. Just part of our classes, not all the classes. Am I right? Can I rightly answer to your question?
Yeah. I just wondering that I thought that Japan is still everybody's still in home.
Yeah, actually, maybe I have to also write to you. I got some budget for research about halal food. Maybe we need some experts from Indonesia.
And also from Philippines, maybe. With health.
No halal. We eat everything. 10 more minutes.
Okay, it's okay.
We wish to check everybody here.
My room is kind of
Just Dr. Shafi.
Dr. Shafi.
I think Mizumoto-san, it's against the light.
Maybe. Wait.
Against, yeah, just turn your laptop or something.
Better? Better?
Oh,
no, then.
Is it a laptop or? Yeah, probably it would be better. Yeah.
Better?
Yeah. The sun. Dr. Shafi, wa?
I think he fell asleep, I think.
I hope not.
丸先生が見えない。
私、スピーカーではないので、はい、オーディエンスとして参加いたします。
I'm waiting for my students to join. I told them they should. And the Mongolian students, the JDS
student, where are they?
Sagana?
Sagana, yes, I told them. But I don't know if they have classes already by this time. Yeah. But Nakamura Sensei said he's going to join. I sent the link to them. Anyway, they could still watch it via YouTube. Yeah, I'm recording it as well, ne?
We still have 8 more minutes.
Yeah.
Do you want to orient us, Tia? Dr. Shafi is not yet around.
Yeah, Dr. Shafi is not yet.
Okay, Sagana, please invite Hila. Please invite Sagana Noro.
Sagana's here.
Yeah.
What?
Please invite Sagana.
I think the audience is come from all over Indonesian. It's come from very West Indonesian, in Pontiac, in Borneo.
Hi, Sagana. clear. Can you hear my voice clear?
Yes,
Hello,
I.
Sagana.
Hi.
Sagana.
Hi, Calvin.
How are you?
Can you hear me now?
Yes, loud and clear. No video.
No video.
I don't know. I think you have turned a start video. Okay.
There you are.
I'm
Sagana.
here.
Reunion, Dane. Where are the others?
And I have no idea. I'm in the office. I'm involved, as you know.
Where is Saina? Where is the boss?
I don't know. Boss must be she's in a different building. I don't know. Bosses are busy, kana.
Yeah.
Hi, Baikuni.
Hi.
How are you?
Fine, Sagana. How is everything?
Everything is good. Good. It's nice to see you guys all.
Yeah.
Nice to see you.
Yeah. Do enjoy the
seminar.
Oh, she's gone. She's gone.
Okay.
There you are. Do enjoy the seminar. Yes, so ne. If this was Wednesday, it's like IC semi kana.
Yeah.
We should schedule Wednesday next time.
Exactly.
Come to new normal, we can have like a ICZMI
Yeah,
online, right?
Semi.
Like semi-annual IC semi kana. I'm looking if Nakamura Sensei already logged in.
You will also be there?
Yeah, he said he will attend.
Wow.
I sent him the link. So at least him will be attending. And Dr. Shafi.
Oh, wow. So many familiar faces I will be seeing then.
Calvin, your student will join?
I think so. I told them that they should join, no? I forced them to join. Anyway, I will send the link again.
Is Indra or Baigal?
I don't know if they're joining, but I sent them the link, no?
Okay. David should be available. What did she say?
I don't know.
I should tell her. Baby.
Yeah. Let me check the link again. Oops.
Зүгээр. Нөгөө calendar дээр таам сурч байсан хүмүүс ковидын тухай нэг сургалт явуулж байгаа юм. Тэгээд зүгээр нэг хүм бүрдүүлж авахгүй.
So 4 minutes to go.
Okay. So I hope Dr. Shafi will join. Not yet.
Did you send him a message already? Hello, Agus from Malang, East Java.
Dr. Agustin, not yet, right?
Yeah, not yet. She's not yet around.
I think Sensei already here.
Nakamura Sensei? Yes, he's already here.
Where?
In the attendees group.
So let me check.
Yes, and Nakamura Sensei will be in the meeting.
Why not?
Why
Panelist.
Yes, I think he
I didn't
wants to see
expect
you.
that. Then I made my presentation very roughly.
It's okay.
I have Nakamura Sensei. Konnichiwa.
Hi.
Unmute Sensei.
Yes, I saw his name here.
Konnichiwa, sensei.
Yeah, konnichiwa.
Yeah.
Konnichiwa, sensei.
Konnichiwa.
Konnichiwa. Nakamura
久しぶり。
sensei.
はい。お、久しぶり。はい。
ご無沙汰してます。
Sugoi, sugoi.
Thank you, Sensei, for attend this Zoom meeting in your very busy day.
Yeah. No. Baikuni-san. So, maybe so. This meeting is 2 hours or
Yeah, around 2 hours.
Around 2 hours.
Around 2 hours. Yeah. So 1 hour and 30. So I will leave. Yeah.
Okay.
Okay. But so I'm very glad to see you, all of you, to see you again in this time. So thank you very much for your very excellent arrangement for four countries sessions. Yeah.
Halo Nakamura Sensei.
Oh, konnichiwa.
Halo Sensei, konnichiwa.
こんにちは。お元気ですか？
元気です。
はい。
So we are waiting for Dr. Agustin. Okay, it's already 1 o'clock now.
Okay.
So, Dr. Shafi.
Dr. Shafi.
So,
is he already around?
Yeah, I think. Okay.
Dr. Anke is also here.
Oh, really?
Yeah.
Dr.
Shafi. For a while.
Tui is also here.
Already? Okay. Dr. Shafi has for the link. Please wait. Just waiting for Dr. Agustin.
Yeah, maybe it's already 1 o'clock.
Yeah, okay, I will open.
Everybody may be waiting and we cannot wait.
Yep.
Pak Kemal, this is Yasudi, my professor Yasudi Nakamura is head of WHO Japan. Pak Kemal is rector of IAKMI Cyber University. Sensei, please.
Okay. So
Thank you.
Start now.
Yeah.
Pak Kemal, would you please to give like opening speech, little bit from as a
right now?
rector or a rector for cyber university?
Okay then.
Okay.
Thank you, Tia. Thank you to the MC.
Yeah.
Distinguished speakers.
Start again. First, Pak Kemal.
Yeah.
I will open. Yeah, I will open the session first.
Oh, okay. Please do.
Yeah. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Hello, everyone. Good afternoon. Maybe some of us is like some participant good morning or good night. So thank you. I warmly welcome you to our webinar series, Party 19, Community-Based Fighting Initiative Against COVID-19. I welcome, it's a great honor actually to have all the speakers today. So we have first is from Indonesia, of course, it's Dr. Baikuni. And then we have Dr. Calvin S. De Los Reyes from Philippines. And we also have Professor Kaori Mizumoto from Japan. And we are waiting for Dr. Shafi Buyan is from Canada. And we also have a very special guest today. So we have a Professor Yasuhide Nakamura as a representative from WHO Japan and also from the Konan Woman University, Kobe, and also Professor Maru, Mitsue Maru from Konan Woman University, Japan. And we have also a special guest from Mongolia. Sagana. Okay, thank you for joining us. So our webinar theme today is a lesson learned responding to the COVID-19 pandemic, experiences from Japan, Canada, the Philippines, and Indonesia. So until now, we have maybe more than 4 million patient of positive COVID-19 in the world. So from the beginning cases in Wuhan at that time, and in Indonesia we have the first case in March 2, and it keeps increasing. And of course we have some regulation and some intervention to decrease to stop the infection, but of course it's not easy because now it's like our problem in the world. Now the sharing experience among the country is valuable for us to know what kind of intervention that has been done in other countries, so we can learn how to fight against this pandemic. So thank you also for us. Welcome, Dr. Agustin. Thank you. Okay. And so I don't want to speak longest. I want to thank you also for all the participants that attend in this room, and also maybe watching in our YouTube streaming. So thank you. Hello, Dr. Shafi. Also, I'm sorry, I have to please at Dr. Shafi, Sila.
Safi,
Dr. Shafi. So first, I want to let the Dr. Kemal Siregar to give opening speech for our special webinar today. Dr. Kemal Siregar is rector of Indonesian Public Health Association Cyber University. So we have just launched this Cyber University. So Dr. Kemal, could you please give some?
Okay. Thank you, Tia. Can you hear me?
Yeah.
Is it clear, my voice?
It's clear.
Yes, clear, Pak.
Okay, thank you, thank you. Okay.
It's clear.
Okay. Distinguished speakers, panelists, facilitator, and all the participants. And I see that the participants is more than 150. It's quite a lot, yeah. Good morning to everyone. I want to say hello, especially to Professor Nakamura from WHO, Professor Kaori Mizumoto and Professor Maru from Japan, Professor Safi, I think he's already here, right? Professor Safi from Canada,
Yeah,
Dr.
flight was delayed, so I just in. Thank you.
Okay, thank you.
Waalaikumsalam, Safi.
Dr. Calvin De Los Reyes from the Philippines. And also, I see the guests from Mongolia. Of course, Dr. Baikuni, Dr. Agustin, as well as Dr. Tia from Indonesia. Ladies and gentlemen, first of all, praise be always we pray to the Almighty God, whose blessings we can meet on this beautiful day. May I give a little introductions at this very important meeting with the theme is lessons learned responding to the COVID-19 pandemic. Experiences from Japan, Canada, the Philippines, and Indonesia. Ladies and gentlemen, many changes occur in our lives now and in the future due to COVID pandemic. It turns out that COVID-19 is a new disease, although previously we also experienced the effects of corona type viruses. In the context of current pandemic, each of us as a country has struggled to deal with the COVID-19, where this disease has a multidimensional nature. The impact of the COVID-19 pandemic is not only on the medical condition of the patients, but also on his or her psychological conditions, even on the social and economic conditions of the wider community. In this meeting, we will learn from each other that to strengthen each other as well, so that each of us can do better in the future. Yeah. Here, I would like to express my gratitude to the presenters for their willingness to provide experiences that occurred in each country. So, Dr. Tia, that's all for my brief introductions, and thank you.
Okay, thank you, Dr.
Good luck.
Welcome, Dr. Safi. I thank you for joining in the middle of the night in Canada, right, in Toronto now.
Is it 2 o'clock here in the morning? I just wake up. I sleep 2 hours, so it's okay. Because
Okay.
I'm
It
excited
seems that
to
you're
see
very...
Nakamura Sensei is here. The Kaori-san is here. My favorite Augustine is here. The big boss and Baikuni, my favorite chef, is here. Kelvin, the junior is here. So great.
Okay.
So this is a family reunion.
Nakamura family is here, so I'm here. So finally.
Okay. So now it's time for Dr. Baikuni to be the first presenter, and I remind you that we have 20 minutes for you for each of the presenter. We have 20 minutes, and Dr. Baikuni will help. Yeah. So first, I want to introduce Dr. Baikuni. So Dr. Baikuni graduate from Faculty of Public Health, University of Indonesia for his bachelor and master degree, and then he continues his PhD in Osaka University, Japan. And now he is as the lecturer in Faculty of Health Sciences, University State Islamic University Syarif Hidayatullah Jakarta, but also he is the president of Indonesian Public Health Association of Jakarta. So now time for you to present your presentation. Dozo.
Thank you very much. But the PPT is not so. Please. Nari Lamatia.
We cannot see your screen.
Not yet.
Yeah. Dark. Why?
Sometimes it's like lag. It's okay, Pilar?
Okay.
Good. Bless you.
Okay. Thank you very much for everybody. Yeah. I will start my presentations. Peace be upon you. Good afternoon. I'm very happy with our activities today. And this is a very important event where we gather at this place to share about how our respective countries responds to the COVID pandemic 19. Thank you to all my friends and here also present my senior, my lecturers, yeah, my sensei, and everybody. Thank you for joining this Zoom meeting. What? Where is the presentation? I would like to present about Indonesian community-based fighting initiative COVID-19, timeless concept and implementation. Please, Tia. Why? I'm sorry for the presentation. Yeah. I think I will also said that we began with the background of this about please slide. Jangan. Okay, please slide. This my team in okay in the IAKMI Jakarta, Indonesian Public Health Association. Please slide. We began with the background. This is about bar graph showed that the case of the COVID-19 in the nation moved quickly. Slide. Within 60 days, it started with 2 cases on 2 March, become 12, become 12,000 only in 5 March, 5 May. Until now, we don't know where the peak of this pandemic in our country. Slide. This is the graph strike slide. According to our modeler, Dr. Ibnu Susanto, this case will reach 22,000 at the end of the May 20. As we know, the cases per 20 May reach 90,000. Slide. Actually, at the beginning of the pandemic, the government made focus on the curative program, including contact tracing from the person infected. However, the late action to restrict the people comes from abroad make this pandemic become scary and out of control. To respond to that situation, our president make up the decision of restriction for the people to gather in public places, as well as announcing the public health emergency alert to our people. Many school, office, mall, and also tourism and entertainment places closed for the long periods, especially in epicenter area like Jakarta. The management for our COVID-19 is to respond, to detect, and to prevent. I will explain about communities prevention through community-based initiative fighting, or in Indonesian we can say it's Parki 19. Slide. Several days ago, our president realized that for Indonesia, it will be more effective if we encourage people or citizens to fight against this situation. Slide. Now I would like to tell the timelines of Indonesian Public Health Association Jakarta Province to respond COVID-19. Actually, we in EHA of Jakarta, long before everyone showed the community-based COVID-19 strategy, we have already think it from March 20. We made a flyer to respond a campaign to the government to intervene with community-based program to face COVID-19 in Indonesia. I and Narila made an initial concept for community-based fighting initiative, or PARC, for COVID-19 in Indonesia from our organization. On March 20, we sent the COVID proposal to head of the Jakarta Health Service. Mr. Adang Bahtiar, Dedi Supratman, and Dedi Darmawan also helped finalize the proposal and concept in March 19. Slide. On the March 28th, we made press release to urge the governor Jakarta for March 19 in our province in here. On the March 30, we disseminate the March 19 information through mass media like Kompas, Republika, and several other media that's known in Indonesia. Slide. March 19 Tangerang Selatan, Banten Province began in early 20 collaboration with Indonesian Nurse Organization. Slide. April 30, we took part in the meeting held by EFHA, Campus or Public Health Association, and the Kita Aman, like information system in computer-based, to mobilize 180 universities throughout Indonesia to run Part 19 through community service, field work, and other tasks that as a part of the lecture. And then we do a web zone series every Friday. Yeah, slide, seeking collaborating support and making the Part 19 approach known in Indonesia in the world. Jadi, so every Fridays we have like a Zoom meeting. Slide. Quick slide. Slide quick. Slide. Training of trainer Part 19 was attended by around 2,000 participants from village representative at health organization. Slide. In Nusa Tenggara Timur, is east of the Indonesian. Slide. Lately, we integrate Part J methods with the mosque as cultural center in Villa Dago, Tangerang, and it will be replicated by 800,000 mosques throughout Indonesia. This activity will call reaching from the mosque. So that now Part 19 or community-based fighting initiative from our organization will replicate in all Indonesians from the mosque, university, and all over the groups. On the third week of June 2020, a conference will be held between Indonesia and Japan Exchange, and Sensei will arrange that with us. And then Villa Dago Banten Province Community Fighting Initiative intervention starting at the beginning of the March. This is Villa Dago Banten Province. I will tell you about the story in this field Part C interventions. Slide. Basis of the concept of community-based fighting initiative COVID-19 or Part 19 is fifth level health prevention from level and health, like health promotion activities in the form of education on cleaning and healthy behavior and environmental sanitation, and special protection activities in the form of supervision of the implementation and social physical distancing, early diagnosis and immediate treatment activities in the form of COVID-19 surveillance system, and disability limitation activities, and also rehabilitation activities in the form of mitigation of social economic impact of the pandemic, people with the pandemic. Now I will tell Part 19 in the field. Slide here. This picture shows, slide. This picture shows health promotion activities in the form of education on clean, healthy behavior and environment sanitation. We do these activities twice a week. All the budgets come from communities as well as the workers. In every store, slide, we put the water and soap as well as we control social distancing for the people in this area. Slide. This is the picture. Yeah. So you can see in every store water and soap, as well as control social distancing. Do this in this area. Slide. This is a slide about special protection activity in the form of supervision of the implementation of social physical distancing. We include program government agency to do this with police and other government government official. Slide. And also, this is early diagnosis and immediate treatment activities in the form of COVID-19 surveillance system. We collect data on the people who are at high risk and make guidance system through WhatsApp group. And also we did a rapid test for the people. Even we lack this tool to solve the situation, we made cluster and grouping the people and collect the sample. Slide. Then slide. This is rapid test. This showed that rehabilitation activities in the form of the mitigation of social economic impact. We realize this situation is very hard for some people, especially as an informal worker who collect their salaries as the day-to-day basis. If the situation extends until 2 months or more, it will make impacted to those people very badly. From now, we have prepared to that situation. We made the fundraising to support the needy as well as for supporting Part 19 program in communities. I think this is the end of my presentation. This effort is different from other community approach because one, Part 19 concept is a holistic approach, not only taking into account COVID's problems, but also paying attention to the mental, social, and economic impact of the population. Second, this concept prioritizes a social approach and cultural change through education and community discipline so that this approach makes society subject and this differ from the structural approach that makes society only the object of the policy. Third, the concept can also be carried out with the cooperation with various groups and accompanying them to move together against the COVID pandemic 19. Fourth, the basis of this concept is the 5-level prevention, which is the basic science of the public health approach. Thank you all for listening to this presentation. If are any shortcoming in the presentation, please forgive me. Thank you very much. Come to Tia. Okay, Tia, I have ready.
Thank you for your presentation, Dr. Baikuni. And I think now we come to the next presenter, Dr. Calvin S. de los Reyes. He got his Master of Pharmaceutical Sciences in Osaka University, Japan. And then he continued for PhD in Global Human Science Division, Graduate School of Human Science in Osaka University, Japan. And his bachelor is in public health. So he has so many training. Lately, I think he joined the Harvard specialization, right, for epidemiology, social epidemiology in Japan. And a lot of experience, especially as like in the maternal and child health handbook area, and then now currently he's a senior lecturer in Master of Art of Health Policy Studies, Department of Behavioral Science, College of Art and Science, University of the Philippines, Manila. So now I want to read all of your CV, Dr. Calvin, but now but it looks like longer. So Okay, now it's time for you to present. Hila, can you help to present? Okay.
Thank you very much, Tia. Thank you very much to everyone who is joining us from Indonesia, from the Philippines, from all over. It's a pleasure to present my humble endeavor. Actually, this is when Tia and Baikuni, my colleagues from Osaka University from way back, asked me to do this presentation. I was a bit nervous because I have very limited expertise or background when it comes to COVID-19 in the country, but I will try my best. Basically, my presentation for today would be divided into two parts. The first part would be the national response against COVID-19, and the latter part would be some glimpses of, I believe, unique efforts or community-based initiatives in the management of COVID-19. Next slide. As of May 21st, 2020, there's a total of 5 million cases worldwide already in 227 countries. There are 2 million, about 3 million active cases and 330,000 deaths. And it's no different in the Philippines. In a recent DOH report, there were 13,000 confirmed cases and 846 deaths to date. The Philippines, for those who are not aware where the country is an archipelagic country of 107 million in population. And it is in Southeast Asia with 7,641 islands. And it is divided further into three main geographical divisions from north to south: Luzon, Visayas, and Mindanao. The capital of the Philippines is Manila, with the urban area of Metro Manila the epicenter of the pandemic in the country. Next slide, please. Now, let me briefly present to you the timeline of COVID-19 in the Philippines. And as early as January, there were a few tourists having their holiday in the island of Cebu, in the Visayas group of islands, who were found to be positive of the virus. The Department of Health took appropriate actions in terms of contact tracing. A few cases were later on identified in several parts of the country, but most of them were concentrated in Metro Manila. Do note, however, that most of the tests were readily available in the capital. In early March, the government proclaimed the state of public health emergency and state of calamity. Metro Manila was initially placed under community quarantine, and briefly after that, we have the so-called enhanced community quarantine, or ECQ, which was enforced in the whole island of Luzon, home to half of the country's population. With ECQ enforced, social distancing was observed. Residents were asked to stay in their homes. Malls were closed. Public gatherings were prohibited, and curfew was enforced. No public transportation allowed. And based on the data of the DOH, or the Department of Health, and consultations with local chief executives and stakeholders, the strict quarantine measures were extended. Only in May 16, just a week ago, when the ECQ was modified, is eased for the first time in 2 months, and the MECQ is expected to end by the end of the month. By then, the Philippines would have surpassed Wuhan with the longest lockdown against COVID-19. Next slide. What you can see here is actually 4 doors. No, this is the response framework by the Department of Health. And looking at this slide, we can see from the identification, it easily jumped to level 3. No, this happened in only about 4 weeks after after the first cases were identified. So that's how COVID-19 was to us. And it's already alert blue. And when we talk about alert blue or curve blue, there were temporary travel ban of travelers, contact tracing and implementation of quarantine. Filipinos were coming from Wuhan were quarantined. We made sure that laboratories and hospitals are prepared, and the Department of Health engaged the communities, and regular situational report and case trackers were implemented. And in early March, the country is level 4, code red. This is how fast the epidemic progressed. The Interagency Task Force, or the IATF, currently chaired by the Department of Health, is crucial in the response against the pandemic. Next slide. So the IATF was actually very instrumental. This is the body, created in 2014 in response to SARS and other emerging infectious diseases like the MERS-CoV, among others. They are organized to respond to emerging infectious diseases in the Philippines. And one of the chairs of this IATF EID in the Philippines at the moment is co-chaired by the Department of Health, together with other members from other national agencies or departments such as the Department of Interior, Local and Government, DNR, among others. The role of the IATF is to basically report to the President and recommend courses of actions. So it issues guidelines and policies for the local government units to adopt, and one of this is the community quarantine measure. Next slide. I was looking online as to the available information as to what guided the national government. What are the strategy for beating COVID-19 at its earlier phases, no? And luckily, I found this from the Department of Health site, no? The nation's strategies against COVID-19 is guided by the following 4 components. Number 1 is enhanced community quarantine and social distancing. Number 2 is contact tracing and surveillance. Number 3 is the triage system and increased testing. And number 4 is the improved cases management of patients. Let us go through them one by one. So next slide, please. What is significant, especially in the Philippines, is that we observed enhanced community quarantine from, if I'm not mistaken, from mid-March, no? And it sought to prevent the spread of the virus in a given community. It also limits the movement of people so that there is a smaller chance for people to infect or get infected by others. Basically, it protects us, especially the most vulnerable. And on your right are some of the guidelines of what the Filipinos are expected to do, mainly stay at home, maintain the 1 meter distance, no, avoiding crowds, and also continuing the practice of good hygiene, no, etc. Number 2 is contact tracing and surveillance. Contact tracing is the process by which the Department of Health identifies people who have been exposed to COVID-19 patients and reaches out to them. Please remember that even those without symptoms may have COVID-19 and could be spreading the virus unknowingly. Surveillance, on the other hand, is the process of finding potential COVID-19 cases among those suffering from severe acute respiratory illnesses. This is done to catch other possible COVID-19 cases outside the contact tracing activities. So again, on the left, on your right, is the number of what you can do, what in Filipino individuals could do in case the Department of Health contacts you. Yeah, there are basically 4 guidelines. And then the third one, next slide, is the triage system and increased testing. The DOH is improving the testing facilities and acquiring new kits so that more patients can be tested. While the testing is being increased, the number of testing is being increased. In the meantime, all individuals are also classified according to the process called triage. Priority in testing is given to those who have weakened immune system, those who are people over 65 years of age, with existing conditions or comorbidities or severe symptoms. They need to be treated right away as they are the most vulnerable. Here, I listed down our statistics, some of the numbers when it comes to the testing facilities in the country. And so far, luckily, we have a very good updated data coming from the Department of Health. We have 31 RT-PCR licensed laboratories which reach stage 5 there, meaning they could conduct the testing accordingly. There are 7 licensed gene expert labs, and about 89 labs are expected to laboratories are from stage 3 and up. And hopefully soon they would be upgraded to stage 4 and further to stage 5. So Also, according to the Department of Health, 75% of laboratories at stage 3s are already up. So soon, hopefully, have a larger number of RT-PCR licensed laboratories in the country, all over the country. Next slide, please. Thank you. Furthermore, number 4, one of the components is the improved case management of patients. And when we say this, we allocate additional health equipment and supplies such as PPEs, respirators, medicines to health facilities that manage COVID-19 cases. In addition to this, we capacitate health workers and update them on the latest guidelines on how to take care of patients based on new evidences and developments from reputable health organizations. On your left is on your right rather is a chart presenting the hospital beds and mechanical ventilators for COVID-19. And as you can see here, fortunately, we're not overwhelmed. No, there are we have more than 13,000 total bed capacity, and yes, there you go. Okay, next slide, please. So, how is the Philippines faring against the pandemic? Let us look at this epidemiologic curve prepared by our team. I am fortunately a member of COVID-19 tracker of local epidemics, spearheaded by Professor Maridel Borja of the University of the Philippines. Yeah, with data from the DOH. Note, in order for us to understand this graph, note that the red line shows the 7-day moving average of cases, in turn, derived from the average number of cases from 3 days before to 3 days after the date. Also be mindful that this data are not the onset of diseases, rather they were when the cases were being reported. And actually the data system were such, the data are basically coming late, when it started. And that's why we look at the 7-day average instead. Next slide. In the next slide, you can see that I emphasize the March 15 date, where the ECQ started. So that's about 2 months ago, And the early stage happened in late January to early March. And at that time, there were few cases due to good containment. And however, during this time as well, we have very limited testing. But starting the second week of March, there were an acute rise of cases that led to the community quarantine lockdown. Also at the time, there was an increasing demand of critical care in the hospitals, acute need and shortage of PPEs among health workers, and increased demand for quarantine facilities for suspected cases. Next slide, please. We can see that within the 3 weeks from March 15 to, let's say, April 6, April 6, we saw the effects of ECQ already, the enhanced community quarantine. The cases began to drop. By this time, testing was only at the level of 300 to 500 tests a day, still quite limited compared to other countries during that time. And there were ongoing community spread from April 2nd week to actually the first week of May. By the second week of April, however, it should be noted that there are several public-private collaborations already being tapped. And with these collaborations, there's a ramp up with the testing capacity and contact tracing and data management. Also, around April, constant communication from the Department of Health, daily reports on the number of cases, precautions, and guidelines were already presented through social media and through TV and radio. General community quarantines in area of low and moderate risk could remain, though. On the next slide, I want to show April 18, where there's of course still the ECQ effect and the higher testing. As testing ramped up to the level of 3,000 to 5,000 a day, the pump here, as pointed out, is the ECQ effect and an increase in testing. And so, next slide, we are now seeing it stay at this level. So somehow, I know it's a rough plateau. Up to May 20, around 200 to 200 confirmed cases, with the hope if not decreased, remain at a manageable level as ECQ is gradually being lifted to support the economy of the country. Okay. Here, next slide, I present to you what I was telling about. I keep on talking about ECQ. And of course, this quarantine measures has to, there's a transition. There should be a transition from ECQ to GCQ. For our non-Filipino webinar participants, this slide shows the national government's phase transition from ECQ to GCQ. Metro Manila at the moment is actually in the modified ECQ. If you look at it closely, there are some opening of some businesses to support the country's economy, but still there's a strict observance of social distancing and congregation, no? Limited to, if I'm not mistaken, 5 maximum people gathering together. Now, next slide. The question remains is that, are we flattening the curve, no? I want to quote one of the IATF's epidemiologists on this. No, he noted, Dr. John Wong, actually, also from the University of the Philippines, Manila. He noted that one of the indicators were saying that there's a flattening was the longer time it took for the number of cases and deaths to double. Before the government put major parts of the country on ECQ or lockdown in March, the average case doubling time nationwide was 2.5 days. As of the moment, the average doubling time was 4.6 days in Luzon, excluding Metro Manila, having the longest doubling time of 5.8. A reduction in coronavirus death was also observed across the country. From 4 days, the average time for the number of deaths of double is now 5.7 days nationwide, except for Metro Manila. All geographic areas have recorded a mortality doubling time of at least 7 days. If there's no significant changes, the flattening will continue, so to speak, meaning we will have very few additional cases. And hopefully, if this is such, we reduce the number of new COVID-19 cases from one day to the next. And this would further prevent healthcare systems from becoming overwhelmed. There you go. Next slide. So here, I wanted to share the latest report by DOH. Further tells us the rate of COVID-19 positives to individuals tested has declined from peak of 17.5% early in April with limited tests down to 8.1% by mid-May. That despite despite the number of tested increasing from 23,000 to 208,000 or 207.8 thousand over this period. So basically, next slide, that sums up of what's happening in the country, in the nation, when we talk about the countrywide, no, in the Philippines. So what I'm going to present next is how did the local government units respond. So they adopted community quarantine measures as well, preventive measures were also adopted following the AATF or the Interagency Task Force I've mentioned earlier. Contact tracing using the BHERTZ, ordered malls and other establishments temporarily closed, except for stores selling essentials. Curfew was enforced and set up quarantine quarters and measures to ensure social distancing. Local pandemic and control strategies developed and implemented. Next slide. So let me guide you through some of these bits and pieces of initiatives or endeavors in the local government units, which I found unique, no? And we will be guided by this pandemic control strategy, which is actually step-by-step prevention, detection, isolation, reintegration, and adapting to the new normal. Next slide. In terms of prevention, it is very important that people are aware, the Filipinos are aware. And this is conducted by several daily press conferences, may it be on TV, radio, or social media. Of course, there are local information dissemination campaigns, which emphasizes on social distancing measures. And you will see some examples later on. Next slide. This, what I wanted to show is a morning public briefing from 11 in the morning, hosted by the Presidential Communications Operations Office. No, In the afternoon, next slide, what we have is the briefing at 4 o'clock by the Department of Health. And this is the Beat COVID-19 virtual presser. This became a 4 o'clock habit to most Filipinos when we wanted to be updated about COVID-19. Next slide. In addition to this, what you can see here is a localized version of IEC materials from a municipality in the Visayas, which use local languages, in order to promote proper COVID-19 management. Next slide. And also, luckily, the Department of Health has a chest or a wealth of information, materials rather, that could be adapted according to the needs of the local community. Most of this are being shared online through social media platforms. And then furthermore, next slide. I'm sorry, Tia. We have the mobile loudspeaker operations, as you can see here. So what do? Is they, to more rural barangays, it's quite common that they have this loudspeaker going around, roaming around. A mobile loudspeaker is used. And the loudspeaker is instrumental as it conveys factual information on precautionary measures, reminding the locals of community announcements. And next slide. On a more creative side, some local authorities have set up even coffins at checkpoint as a reminder of the lethal COVID-19 infection. The message of stay at home or stay inside the coffin is clear. To reiterate, the virus should not be taken lightly. Thank you. As for the detection, we have, I will run through this because I believe I'm almost, my time is almost up. Let me present some of the detection, test and tracing activities in the local government units. We do have the public-private partnership as an example here for the community-based rapid testing known as Project ARC. It's a private sector-led initiative which conducts massive testing for the coronavirus there. But what I am most proud of, next slide, is actually this Philippine-made COVID-19 detection kit. It is known as Gene Amplify, that had been developed by University of the Philippines on the onset of COVID-19 in the UP National Institute for Health and approved by the FDA. And the development of this kit is also a promise of better and accessibility to the public because it's lesser in terms of cost. For one test, it's about 1,320 pesos or 26 US dollars or 385,000 rupiah only per test, as compared to more foreign-made kits, which is 8,500 pesos, 170 US dollars or 2.5 million Indonesian rupiahs. There you go. Also, because of the development of this kit, next slide, some of the municipalities, were encouraged to build their own coronavirus testing laboratory. So this is not unique in this municipality. Some other municipalities who found some budget to maximize their efforts against COVID-19. Okay, there. Next slide. And as I mentioned to you earlier, we also have the BHERT, the Barangay Health Emergency Response Team. It links the cases to nearby health facilities. Taking advantage of the BHERTs, because these are individuals, who are these people? These are individuals who reside in the community. It is composed of a barangay guard or tanod and 2 barangay health workers, and they roam around the said barangay or community to identify suspected cases. There you go. Next slide. Next slide, please. Again, next slide. I'm sorry. There you go. It is very important that this BHERT should don the PPEs to ensure their health and safety there. So we have okay. And then furthermore, next slide, we also have local contact tracing systems that are developed by certain provincial government because they wanted to ensure to achieve accuracy in terms of locating individuals who might have interacted with patients there. Next slide. Also, with the increasing number of suspected cases and limited capacity of the referral hospital in the Eastern Visayas region, some local government units have built their own isolation facility, as you can see here. No, this makeshift isolation facility is intended to those who will be in need of immediate care and stringent monitoring. There you go. Next slide. And we also have our quarantine passes. It allows the passage of only one household member in or out the barangays. It is limited for the purchase of essentials like food in public markets, groceries, and supermarkets. Next slide. We also have our isolation units, and similar to what the quarantine units that we have, but the difference with this one is that this was built in the island of Basilan in Mindanao, where it is intended to intended for residents who are coming home from another island, Luzon, for quarantine. Next slide. And we cannot discount the fact that the need of virtual COVID-19 emergency help desk, limited operations, and you could contact or text them, etc. Next slide. And another is Adopt a Family project. This initiative encourages families in the municipalities to adopt indigent families and support their food and other necessities in the duration of ECQ. Next slide. I think we can move on to the next slide again, Tia. Yes, next slide. Here, I wanted to just emphasize that other than another municipality discovered that face mask making as an income opportunity for the community, especially for those families who are, they lack the appropriate means of earning an income because of the lockdown. So they tasked some of these families to make reusable face masks, and this face masks were distributed to households and also to local hospitals. Next slide. And the following 3 slides will show that our measures ensuring that proper nutrition is promoted in the community. So here, this is backyard vegetable garden, where one municipality promoted backyard gardening by distributing seeds for their constituents. Next slide. And the following 2 is actually a mobile market, where instead of having the locals or the residents go to the market, traveling to the market comes closer to them instead. Okay, next slide. Thank you, Tia. Next, one more. And then lastly, one more. Yeah, what we're talking about the new normal or the post-quarantine measures. What is the new normal? It's basically a mindset, it is said to be letting go of a familiar lifestyle or things we are used to do. So we are not only being aware of ourselves, but being aware of what our environment, our surroundings, and perhaps what would be our workplace practices, schools, etc. would be, and the people we are interacting with. As we move from quarantine, there should be an extra precaution in our new routine. So here, one municipality have enumerated their efforts, and again with emphasis on social distancing. Next slide. Also, there is now no mask, no entry, no mask. Wearing a mask is enforced at all times with an ordinance of enforcing such measures. Okay, and then probably this is already true in other countries. There are contactless consultations being conducted. In the future, the new normal will heavily rely on telephones, internets, telemedicine to ensure the safety of personnel and patients. There you go. And of course, the transportation issues, that you will see here. Yeah, next slide. This is the tricycle. The next one is the jeep. Instead of the passengers being seated to one another, they're already separated. And then also the buses. Next slide. Okay, next slide. Of course, there's social distancing in malls. The Filipinos love malls a lot, so it means we have to control that in order for social distancing to be okay. The remaining slides about the Bayanihan spirit. Filipino word meaning communal unity and cooperation. This is best shown by the old tradition of friends and neighbors of helping and moving family by literally carrying their houses on their backs. So it's what I'm going to enumerate is collaborative efforts among Filipinos to ease the negative effects of COVID-19 in the society. Next slide. So there are this one, yeah, the one earlier is a swabbing facility, and this one, the other one is actually several NPOs and concerned individuals raising funds for meals, grocery items, and PPEs for the frontliners. And the next slide is more on COVID-19 survivors were asked to donate their blood plasma. The convalescent plasma therapy is considered an old method, and it has been tried over the years to treat patients during pandemics. And then, of course, next slide, the role of the academe, the university, as I mentioned to you earlier, and some other individual organizations. Next slide, Iya. So to finalize, slide 61. 61. Next slide. My apologies. No, I became trigger happy with all the next slide, with all of our activities. Now, this is the COVID-19 tracker I was mentioning earlier. Next slide. Yeah, so the question is, what is the new normal and how would it would look like, no? Especially since we have lifted enhanced community quarantine last May 15. So should there be more testing for employees as they return to work? Should a work from home arrangement be considered? Will schools remain closed? And public transportation, particularly in the cities, considered? Next slide. Of course, there are some considerations. The local government units are actually developed their own disaster risk reduction and management plans. However, everybody was taken, in shock with the COVID-19. No, a lot of these LGUs are already prepared, especially with typhoon. No, but we are not as prepared when it comes to COVID-19. Of course, there are the human resource issues. Even at the local government unit, limited number of barangay health workers we have to identify the local support groups to address the increasing cases of mental health issues in the country. They would, a lot of people were saying that they would be the next wave of health concerns after COVID-19. Of course, we have to coordinate volunteer groups to avoid donor burnout. And testing is very important, as you can see in the next slide. There you go. Let me end, there you go, testing. And next, let me end with this point, no, equity and COVID-19. So what is somehow amiss with with what's happening with the initiatives in the general population is addressing the needs of the more marginalized. The Philippines has 16.6% of its population living below the national poverty line. And as mentioned earlier by Kuni, that there are daily wage earners, are they included, beyond the doling out or giving of packs or relief packs? What should we do for them in order for them to meet the needs of the new normal? In addition to these, the indigenous peoples and those in the more remote areas, no. And then finally, there's a growing stigma among the COVID-19 victims, survivors, their family and relatives, and also those and also the frontliners. And then finally, next slide. As of May 20, a total of 2,330 cases are healthcare workers in my country. That's 18%, and 31 deaths among this healthcare workforce, no, to date. It should be. I also want to cite that there are numerous healthcare workers working abroad, Filipino overseas workers who died serving COVID-19. So I want to actually to end my presentation by saluting them. Next slide. No, the frontliners in this time of crisis are health workers, soldiers, and volunteers. So maraming salamat po. So I hope I was able to, if not succinctly, present the public health measures against COVID-19, both in the national level and in the community. Maraming salamat po.
Okay. Maraming salamat po. Thank you. Now we come to the next presenter. So Professor Kaori Mizumoto, she graduated from Faculty of Foreign Studies, IT Prefecture for her bachelor. And then she continued her Master of Primary Healthcare Management course in Mahidol University, Thailand, and then graduate for her PhD from Osaka University, Japan. So now she's a professor in Department of Food Management, Faculty of Nutrition Sciences, Nakamura Gakuen University, Japan, in Fukuoka. Okay, now it's like a 25 minutes for you, Professor Mizumoto. Dozo.
Introduction, and Nakamura Sensei is still there. So, and I'm not really keen to infectious disease control, but I just would like to share the situation of COVID-19 in Japan with you briefly. Okay. And I didn't prepare any country profile, but I want to share the latest data of our population pyramid. We are an aging society. Aging rate of Japan is now 28.4%. It means 3 in 1 of us are at high risk of COVID-19. Okay, and this is the trend of number of confirmed cases. On January 16, we found the first case of COVID-19 in our country. Then on April 18th, cases in our country rate about more than 10,000. This is also latest data of yesterday. Okay, now cumulative confirmed cases of COVID-19 in our country was 16,000, more than 60,000 yesterday. But our government lifted the emergency also yesterday. This is the outline of our COVID-19 epidemic in our country. Okay, as I mentioned, on January 16th, we had the first confirmed case of COVID-19. Then on April 7th, our government made announcement, declaration, state of emergency, especially in Tokyo and 7 prefectures, including the place I belong to. So we stopped whole business trips from April 7th up to now. And I will quote some events from our rest of presentation. Okay, I said on January 16th, we started the first case. We found the first case of COVID-19 in our country, but many of us thought, okay, our beginning of the epidemic started with Diamond Princess. Maybe some of you knew this news. And we were so surprised because of the positive rate of PCR testing, almost 30%. It means COVID-19 is very influential. And actually, aggravation rate of COVID-19 in our country is low, but we were so surprised with those numbers. Okay, as I already shown this slide, and on March 1st, all passengers and crews are released from the cruise and Diamond Princess. Then 3 weeks later, we saw the increasing number of confirmed cases of COVID-19. It took 3 weeks, but we realized so COVID-19 is really spreaded. Then on April 7th, it was state of emergency declared by the government. Then also 3 weeks later, after the declaration, 3 weeks after the declaration, we also saw increasing number of confirmed cases. And this is the trend of patients who needed ventilator in our country, and also yes. And as I mentioned, the aggravation rate is very low in our country, but certain number of patients needed ventilators. In comparison, other countries in Japan saw the increasing speed of confirmed death cases is very slow. So many experts said analyzed things in different way. We are not yet sure who are right, but we are waiting for the result of maybe study in the near future. What our government did is that the government made announcement every day for the self-restraint, and we are said not to go outside, just stay home. And this is the map of self-restraint rate, and this is searched by mobile phone data. And on March 1st, so after the announcement, but people didn't listen to the government. People just went outside. But on the center of the picture, on March 19th, so many people, especially in Tokyo area, they started refraining going outside. So on March 25, the governor of Tokyo made big announcement to refrain and big announcement to people to refrain from going outside, especially during the weekend. But the remarkable thing, remarkable thing I thought was, see the bottom of the slide, on March 29, famous comedian named Ken Shimura died from COVID-19. It came to be a big news for us. So on that weekend, so many people stopped going outside. It was very, very rare case, especially in Japan. I'm not really sure about the other countries. Okay. So in many countries, newspaper picked up his news. So he was very famous from small kids to senior people. And what his death made us is that many people thought COVID-19 is kind of somebody else's problem, but his death made people to think COVID-19 is not somebody else's problem, but our own problems. So this is really a good turning point of people to change their behavior. Actually, the national government and also local government made announcement to the people to refrain going outside several times. And people just follow the announcement. And okay, and especially Tokyo area, more than 80%, people more than 80% of the people stop going outside. Then not only making announcement by the government, but also government promotes 3 Cs to prevent COVID-19. So 3 Cs means closed spaces, crowded places, and close contact settings. So I think this strategy is almost the same as other countries, but people follow this announcement. And especially wearing mask. We Japanese people get accustomed to wearing mask, especially April and May. So because it's the season of hen allergic, but people didn't have any yeah. So people just follow the announcement, and also our government. Oh, it was not the joke of April Fools. I have to change the title. The generous government distributes masks for free to 65 million households nationwide. And it was the announcement was made in early April, but I just received, our households also received the masks last week. It took time. Anyway, so we just followed the request from the government. Okay, and about PCR testing, and the positive rate of PCR test in Japan is not so really high, but it must came to be more than 30%. But the latest data said it was just 4.3%. Okay, the middle of May this month. Yes. Okay, the epidemic is shrinking now. Actually, the number of PCR testing is very small because we didn't have much capacity. It was things mentioned by the government. Actually, the capacity is not really small, but people didn't go for testing because we thought we should also refrain going outside, not going to testing, because if I'm not positive, then go to the testing site. Maybe I will get a virus or something like that. So we ourselves refrained going and getting testing. Yeah, but this is really the problem. It's okay, the first wave is now shrinking, but we have to be preparing for the second wave. So we really need to expand testing capacity. Otherwise, if we stop going outside, the economic will be also shrinking. And on March 24, the government made, actually not the government, but Olympic Committee made big decision. Tokyo Olympics and Paralympics are postponed until next year. So the government of Japan and also people in Japan really worry about the realization of Olympics and Paralympics. Then we didn't want to raise the number of positive rate, the rate of positive PRC positive. Then maybe people refrained going for testing. But after that, after the cancellation of Olympic this year, and they made postpone, then after that, the number of people went for testing increased. So public health issue is always related to social issues. We really realize that. And we Japanese people are still worried about the second wave and third wave of COVID-19, but we also really worry about economic activities. Many small companies are already closed their business. So I said expansion of testing is important to make people release to go outside. Otherwise, our economics will be really declined. And people who studied public health knows this model, the health belief model. I try to use this model to frame our situation. Okay. Social demographic factors, we are already at high risk because we are aging society, aging countries. One in three are at high risk population of COVID-19. So then trade, and we didn't realize 3 months before, we didn't know that COVID-19 is kind of influenza, usual influenza, but we came to know that COVID-19 might be fatal disease. It's really important for the people to start to change their behavior. Okay, our problem in society is losing reputation if infected. And if I'm infected, maybe people would talk about me. Maybe she doesn't follow the announcement by the government. Maybe she went for eating outside, or maybe she went for meeting with her friends. So she is the person who didn't follow the announcement by the government. So it means I'm losing my face. And also social discrimination is kind of serious problem. And one young lady was infected. After she knew the infection, she went back home. And it came to be big news nationwide. And people talk about very badly about her through SNS. So those are threat of COVID-19 in public health, as an issue of public health and social issues. Okay, expectations. We have very big expectation to realize Tokyo Olympics and Paralympics next year. And if to realize that, we should follow the announcement of the government. This is a kind of good point of our country. Also, not only in our country, but people in the world want to get back to normal life. We are kind of tired of just staying at home. Then this kind of threat and expectation, maybe we are going to make good behavior to reduce threat based on expectation for COVID-19 for the next wave and third wave. But important things are also cues to action. Actually, I said not following the announcement by the government is losing reputation of my personal. But people are not actually following the announcement by the government. Government just made requesting. So it's not orders. Especially young people, they don't really follow the declaration. But maybe family support is important. If young generation like my student, actually after the declaration, they travel around. I know, oh, this is okay between us. I cannot tell it to my university, but maybe some fathers and mothers do not to travel. If the family is strict about this matter, so people, students didn't go, but family didn't care about the matter, the students just follow by themselves. So, and also media is important, not TV program. Young student, my student seldom watch TVs today. They spend most time to use SNS. They always watch smartphone to send their message or Instagram. Maybe we can use the SNS as a useful media for the behavioral change of the people against COVID-19. And for adults, orders by company is really strong. Actually, the government, national government, and also local government made just requests. They couldn't make any orders because of our laws didn't allow them to make orders, just request. So, but the order from the companies or any organization we belong to, we have to follow the rules. So maybe cues to action in our country, orders by company is strongest, and SNS publication is SNS is also strong, and some support can be working out. But based on the request by government, it's important. Then those things are hold together can make people to change behavior to prevent COVID-19 for the next wave and third wave. This is just my own analysis. And we lifted the state emergency yesterday, but we have to follow the recommendation of new life. It's also the things are almost the same as during the declaration state emergency. So, but it's really important, as I mentioned, as I introduced the case of our famous comedian, Ken Simla. So the COVID-19 is not somebody else's problem. So if we really think it's my own problem, it's our problem. If people think so, maybe we can prevent the COVID-19 for next wave and the third wave. I believe that. Okay, and development potential medication. So it's really important. Some specialists say that, but in our country, it took time, maybe 2 or 3 years to introduce new medications. But yeah, and I think prevention is prevention first. Then we are waiting for the medication development. Thank you very much. That's all for my presentation.
Okay, thank you for your presentation, Mizumoto-san. And now is Professor Nakamura will have another
yeah. Could you please add things?
Yeah.
So I want, before the next presenter, I want to give
I thought they already left.
to have some comment. Please, Nakamura-sensei.
Yeah. Okay. Tia-san and Kaori-san, so thank you very much. So yeah, very nice presentation. I enjoyed very much about so excellent and so informative and this COVID-19 so countries experience. So very nice. So I enjoy a lot. So this symposium, and so I am very pleased to listen the so exchange of the so control program of the for each country. And so thank you very much, Tia-san, Baikuni-san, Kaori-san, and Agustin, Calvins, and Shafis, and Mongolian researchers. And so thank you very much. Yeah, I think this COVID-19 pandemic is not a crisis of the infectious disease, and not a crisis of health, not only the crisis of health. We are social, economic, and development crisis. And that means we need a human science. So not only medicines and health science cannot solve this one. We need a human sciences. And so that's I am very glad. So such a graduate of the alumni of the human sciences of the Osaka University gathered together in this network of the Zoom network. And I'd like to say so such a very in the time of the very good lessons learned, I would like to emphasize only 2 things. One, that is that we need much more lessons learned from the history and lessons learned from the global viewpoint. For the history viewpoint, I would like to say in Japan, we experienced 100 years ago Spanish flu. It's a so very big and very dangerous pandemic. And in that time, so Japanese government strongly push the citizens to wear the mask 100 years ago. And that's why, so I understand Japanese likes the mask very much. And so I didn't know why, but so in this time, so I understand 100 years ago, so there's many documents say people should wear the mask if you want to go to the cinema, if you want to go to the train or bus, you should wear the mask. This is the 100 years ago. This is a very similar to the now, so a new lifestyle government said. But so this is a 100 years ago. Also, the Japanese government did this one. This is one thing. Second thing is only one country cannot solve this COVID-19 pandemic because so this is a pandemic. That's why so we need to learn the lessons learned from other countries. That's why this is a very good so opportunity of the Zoom conference, and please expand and this network, and not only today, so next time or next month, and in that time, so now, so I'm a president of the WHO Japan, and also that's why, so I would like to participate next time or next month, or so I'd like also participate in the discussion of our very nice network group. So thank you very much for your participation and for your excellent arrangement. Thank you very much.
Thank you, Sensei. Thank you. It's we are very happy and very glad you're here now. So maybe we can move to next presenter with Dr. Safi Buyang. So he holds an MBBS from the University of Dhaka and Master of Public Health from Mahidol University and PhD in Global Human Sciences in Osaka University. And he also has MBA in Global Healthcare Management from Ryerson University, Canada. And he has recognized as a leader in global public health education and research initiative, and taught for over 15 years in global public health. Now he is an assistant professor in University of Toronto, adjunct professor in Ryerson University, and also visiting professor in Bangladesh University of Health Sciences, and also chair of Canadian Coalition for Global Health Research. So now it's time for you, Dr. Shafi. Thank you very much. Also, Professor Yasuhide Nakamura. Okay, Dr. Shafi, please.
Okay. Can you hear me?
Yeah.
It's okay?
It's okay.
Yes, Safi, it's good, clear.
Okay, I want to listen to your voice. Good. Now, yeah, I'm very glad. I'm pleased after many years we are the same group. I thanks actually coronavirus because Corona made it possible to keep us together, at least one good thing. So all not bad things. So Nakamura Sensei, Augustine, and Kaori-san, we are in the same, like a Wednesday semi, Nakamura semi. So I really appreciate Baikoni to arrange these things. And hopefully I'm not well prepared. As I saw Baikoni, Calvin, and Kauri explain everything, it makes my life a little bit easier. As a Canadian, I would like to say a few things about overall global pandemic and where we are as a Canada, G8 countries like Japan, UK, and Canada, where we are now in compared to our partner countries, and also as a country where we are, or also as a nation like Ontario, where we are now, and what kind of activities we are doing. So I will just give you the scenario very briefly. You can see next slide that COVID-19 world pandemic, we are just behind following the Japan. So Japan is doing very well actually, along with South Korea. As of last night, we have 81,000 plus cases and the death only 6,000. I said death only, but any death is dangerous, but still we are saving many lives with so many interventions. And majority of the people, more than 50% people already recovered. This gives us a very good signal. If you give special precautions, if you maintain the physical distancing on other things as you described, that it would be great to control this virus. So as of 60 or 66 days, wherever we are now, we are trying to flatten the curve. In other words, maybe we are not flattening the curve rightly, like we may with the plateau situation, so that we can give time to the health professionals, to the health system to accept the patients, so that nothing will be so serious. As you know, 80% of the case is not so severe. They faces less symptom and other things, but maybe out of 20%, maybe 5% is severe or 4% is severe. They need really ventilator or ICU support. That's why Canadian must emphasize on delayed this kind of attack. So that's why I want to make it confined. So that's why they arrange stay home and save life. Next slide. You can see in a nutshell. So only 6,000 deaths so far. And mostly these deaths, unfortunately, in Quebec and Ontario. And you know, both two cities is densely populated than the other provinces. But Quebec is also issue of the socio-economic condition. There's also in the global issue now. If you see New York or other big cities, those who are too many cases, we can see the ethnicity, race, and socio-economic condition is a matter. So in that context, we can see Quebec is much more higher hit, and Ontario is highly populated now. So many diverse group of population here is a global hub, like a laboratory, human laboratory. You can do anything here, from the food testing to the disease, anything you can do in Toronto. So that's why our heat is a little bit higher than other cities and provinces. Next slide. So you can easily see the trend, the case, recovered, and death. We are very proud that healthcare system and the provincial and the national federal government is doing pretty good job. If we go to the next slide, epidemic curve, then unlike other countries, so can you go next slide? So you can see the things are. Sorry, can you? Yeah. So you can see as of May 13, we actually going a downward curve, and then it's not much that going high anymore after middle and end of the April, but still we have many more things to do. I'm not going to explain. I will explain some intervention what we are doing later on. So if you see the demographic distribution, majority cases, as I said, contained in Quebec and Ontario, and majority death is reported Quebec and Ontario too, and no new cases last few days, much more. And we also almost new death have been reported in past 24 hours is actually significantly reducing, especially last week. If you see the daily average percentage of positive over a period of time is only around 4%. Can you go next slide? So if you go to the next slide, Tia, then you can see the female and male ratio. Almost female is higher than the male, like 55% is female is attacked by the COVID virus, and they are mostly community spread. Even though we know many Japanese newspaper I saw maybe a couple of days ago, Osaka or Kobe governor said women, they don't want to go to shopping center. The men, they should go for shopping because they may stay longer period of time, then they may spread infection. So same thing here, women are staying home, but its community spread already happened, and that's why I think female, they are much more affected than the male. And if you go to the next slide, so you can see who are the people we are testing mostly, we categorize in 4 category. So general population, those who have a sign, symptom. Previously, the people are thinking about the 3 symptom, like you have a cough and then headache and fever, then you need to go for diagnosis or test. Now, any of the 1 symptom you pause, you can go to the testing center. And inpatient care, all the inpatient people, they have a symptom and sign, they should be tested. And retirement homes, this is the most high heated area. I don't know well about the Japan, but Canada, most of the death is in the long-term care center or nursing home is our outbreak happen. And specific priority people also, cancer patient, dialysis patient, newborn, and other the disease comorbid patients, they also are under coverage of this testing, because Canada think about test is number 1 priority, and then other thing is later. That's why testing is hugely now going on. About it maybe 16,000 to 25,000 tests is going on per day, which is really very handsome number in terms of the small capacity in the health professionals at the very quick, rapid changing world. We don't know what happened next week, next month, but these things are going very smooth. Can I go next? If you can see what I said, the testing sequence, how testing is going on every day in the testing sites. We have testing sites other than the hospital. Different cities, they have a designated testing sites. Anywhere anybody can go and they can test their things. And as you know, we have also flattened the curve database, and also link people in every area. They can go and they can put their situation, and then government, provincial health, hospital resource mobilization can happen based on the information people input their data. So there is a 3 or 4 kind of information they are looking for. Those who are really vulnerable, those who are really not sure but suspected, those who are really in serious situation. This kind of 3 or 4 category, they provide the information. Based on the information, testing side increased, and hospital resource mobilized accordingly. Next, I'm going to narrow it down from Canada to the Ontario, where we reside, which is very important province. Many people is there. So as of May 19, we have a 3 category to reopening. You know, the economy, the G8 country, they're not talking about the people only, they also talk about the money. So this is the huge challenging thing. Who's first, money first or people first? They take care of the people, but now they are also thinking about how to open the lockdown, as Japan already reopened, or they lift out the lockdown, but Canada not yet. And they just make a roadmap. They said it's a roadmap, not the opening schedule, is a roadmap. So they want to see how it goes. So industry, service, retail, very limited level. They are going to open when two or more than 2 weeks is a case go down or going close to negative number than previous week. And stage 2, they would like to open the workplaces, but with so many restriction. But it should just improve the number of the centers they're going to open, but not high gathering, but public gathering with some conditions to follow the public health rules. And stage 3 will be the opening all workplaces. And still, Premier or our Prime Minister, I know you know our Prime Minister Justin Trudeau is very famous. Every day, 11 o'clock, he came to public and he organized all the support the government of Canada is providing to the people, so people can come and relax and they can stay home. Next slide. Most important thing Canadians are following is physical distancing. They always try to maintain city of Toronto and every city and municipality. They just everywhere, anywhere, and they close the park, they close shopping malls everywhere. They have a sign there. So stay away and stay home, save life. And health professional also making the ad that you stay home, we will take care of the rest, kind of thing. So this physical distancing is number one precondition in the community level. People try to help each other. And like example, people staying at home, but neighbors or somebody is going for shopping and they're helping their shopping, or they're going to understand how best utilization of the facilities, not to make them so much crowded. So every shopping mall or supermarket, they have also health advisory arrangement. So they are controlling people every day from morning to afternoon. Of course, the supermarkets are now reduced hour to reduce the burden, to reduce the crowded situation. If you go to the next slide, most importantly, G8 countries, I think Canada is not different. So we are mostly thinking about the mental health shock. So most of the effect, everybody is thinking when I should go to work, when I go to shopping, when I go to meet friends and go to movie or go to these things, everything just uncertain. So that's why every aspect of the government or our workplaces, we have a support service. You can call, you can discuss with psychologists, with mental health professionals. Even though we have a lot of volunteer lined up mental health, one of the agency here, Mental Health Commission, and CAMH, Canadian Mental Health Institution, those who are providing training of the providers, how to give fast mental health, fast aid mental health approach, like testing, messaging, and listening to the people, not only listening, active listening of the people. So what's going on, what's going through their life, so that they can suggest them, not prescribe medicine, just listening, like health promoting activities. So that is going to happen now. This is very, very demanding now. Our international health professionals, especially my student, also involved now hugely, because we have so many community in different backgrounds, so that we need to reach out to them, minority population, and to explain their own way. So not imposing, but to explaining what is the best interest of for their family or our community. That's why this is one of the biggest community approach to settle down mental health situation. I think all you know, this is the new normal. We will never be able to go back to the normal like before March 18, what we are. So this over. We all need to accept these things. It will never be normal like before. It will be different. Of course, this is all is very painful to understand, to accept, but Canadians said adopt, adopt, and adopt. So this is the only way we should help ourselves. So we cannot expect the back what was happened in early February or early March. Now is a post or post COVID era. We have to be change our attitude and behavior to survive and to live without any major complaint. Can you go for next? So how to mitigate the spread? So there is so many level, individual level. So all the common, I don't need to go everything one by one, but everything, it looks like a same thing. So now already a couple of months, all we know, all the model we know, what works, what not works. We just need to accept and adopt according to our society, our cultural background, based on the cultural background. But anyway, community-based is most emphasis now, avoid crowding, as Kaori-san and other people mentioned very rightly. So we don't want to allow people to go big crowd. That's why Toronto, all the mosques, all the churches are closed. So people stay home. Even many workplaces, many workplaces, if not essential, they should stay home. Like example, we work for the university within 2 to 4 weeks. All actually winter course in February, March, April, last part of the semester, right away we shift from in-person class to the online class. Now the spring, we already majority 80 more than 80% of the classes is online already shifted, and maybe who knows, maybe fall also we are going to have a hybrid model, online versus with limited in-person gathering, maybe, not sure. That is the university. You see, within 2 months, Canadian universities, colleges shifted very promptly, which we are thinking in next maybe 5 or 10 years, we can work virtually. And I can give you one example because I'm academics and Nakamura Sensei is here. So education is the best of solution of any crisis. And as if if I give an example, our school like in Ryerson, in the enrollment is like unbelievably higher than before last year. Example, if last year enrollment is 25,000 and this semester we have a 33,000. So you could imagine, even though we are running all the system by online, but our education capacity, education facilities, everything increased. So that's the good thing. So people are aware. They need to brush up their knowledge. They need to prepare their new normal life. They need to prepare for next educational opportunity or job opportunity. They need to develop their skill. That's why they're coming to the university, even though it's not in person, is online. So next, and government of Canada is very, very structured and very, very widely they try to protect the health and safety of the Canadian. And anything is possible if we have a collaboration, as we have learned from Nakamura Sensei and his all deliberation, international collaboration. Like now is the one world. What we are doing in Canada, people can see it, people can learn from it, or people can follow this. That's why we have to be very cautious and we have to very collegiately, we have to work very collaboratively. Always collective brain, always better than one single brain, same things. And we also contributing to the international response. So Canada always in the pioneer to collaborate with allies, and the governments also maintaining the services to the Canadians. Like example, within one night, Canadian approved, the parliament approved 87 or 107 billion dollar to compensate all the things we need for our safety and security. So that is a huge history in Canadian way. So any Canadian, they are jobless, government ensuring their pay bi-weekly. And if you are a student, you're also getting the benefit from the government without asking anything. You just go online and just log in and submit it. It seems to me there is a very good governance and democracy and very good education system. People should be fine. They understand the limitation, they understand the norm and health policy and procedure. So that's why Canadian actually, I'm very happy and satisfied the way it is controlling by the collective effort of the government and public health officials in Canada. Next, but even though we have so many good things, still we have a challenge and barriers. So all challenges, barriers, not all the time is bad, but some challenges, barrier can give us an opportunity to grow. So I can see that way. So we have a initiative, broader initiative, training like university students, medical students, and health professionals for new immigrants in Canada. So everybody is now helping each other to find the way how to find the contact tracing and not as a problem. So we can find it, we can reach out to them. And physical distancing, like as some of you said, maybe Kaori-san said, people want to go out, they want to meet. So that's people staying in the basement and sitting watching the wall around you. People get bored, so they want to get out. So, and also we have so many vulnerable population, and so many people have so many comorbidities. So it's actually is issue, and so many information out there. Now we have a social media now everywhere, anywhere, and so many, everybody is now health expert. Everybody give their opinion. So that's actually very misleading. So without any valid source, people should not do that, but people keep doing. This is also one of the challenges. And long-term economic impact, of course, as I said, people are losing job. 30 to 40% people may be jobless in future. They're scared. A mental health situation is absolutely is number one issue is coming to happen in coming days. That's why government, NGOs, universities, civil society, and the philanthropists all coming forward to support each other. So that is the beauty of the democracy, actually. Next slide. So now we are in the phase thinking about the reopening of economy, as I said, but also thinking second wave, third wave. So who knows? We don't know. Everything uncertain. Every week is different. So that is the challenging. But by any means, we should have continue improve our testing facilities, cover everybody, and then we have to have physical distancing. This is no doubt. Next. So Canadian government, as I said, they have a individual support system, support for the business, support for the sector wide. So it's a collaborative approach. So individual family, how they are doing and how they can survive and losing the income, how they compensate. Indigenous people is one of the measure. Today also Prime Minister announced support system for them. People who need and most senior people, youth, post-secondary student, everybody is just have their plan how government and community will help them. Even business. So, in the G8 nations, business is the key of economy. We have a billions of trillions of dollar economy. So it need to be move on, but business is shut down. Many business is laid off. So that's why government is giving the extra money to keep their employee get their salary, and also they can bring their food on the table. And all the support system like health is not health only. Health is now intersectoral, as Nakamura-sensei mentioned. All collaborative actions is required. So that's why government also supporting even NGOs, cultural organizations, and non-profit organization, charitable organization, agricultural, food and safety, and tourism. All sector need to be revived and regain their energy. And government support is vital in this situation. And government is coming forward, and community is very passionately waiting directives each and every day, and we are moving forward. Next. And you can see we have to move forward, but how? And we should go forward. There is so many ways we can explain, but maybe we are not at yet high heat. We may have a high heat waiting. Maybe we need to prepare our health system more, because due to this COVID situation, it actually exposed our weak side of the health system, or the any system we have this, so that we need to fix it. And COVID gave us opportunity to learn from this mistake, to learn from this neglected area, how to improve. And maybe we need to digitalize everything on the health system, so that maybe one of the example, MCH handbook, now we are promoting only analog, but maybe now is the time to think go digital everything. So this will be very good challenging things, interesting thing also to cover our maternal child health too, by developing digitalization effort and developing interdisciplinary team. So as I said before, as we also learned many times, so this is one world. We are not enough by one system or one person or one agency. We are multidisciplinary, and we need to collaborate each other. So that is important. So as a Canadian, we are looking forward to work together to overcome this crisis, and we shall overcome. But we don't know when. It may be another 6 months, 1 year or 2 years, but who knows? But we have to be better prepared. Is a new normal. We need to adopt. We need to adjust, and we need to take care of our family, our community, our society, the way the country will be taken care of. So that is my experience. So. Is it okay? Any questions? Any comment? But
Okay, thank you, Dr. Safi. We will
Yeah,
have.
you can see just this afternoon I went to a community center where long-term care people there. So as you know, I am also proud Lion since I am in the medical school. So our energy and Lions International give us all the support system to donate to volunteer the nursing home. This is the Filipino lady who is the executive director of the center. Her name is Rebecca McCallow, and she and her colleague and my colleagues, so we distribute today all the PPEs so that the nursing home can be safe and secure for our seniors. So that is the example. This kind of volunteer things also very important, and everywhere, anywhere, people are doing that. And actually, we continue to do this good thing, and I encourage all of you that please work together. As Nakamura also mentioned, we will continue exchange our information and knowledge sharing, and then that's the way we will learn more and we will support. Any small effort actually make us a big impact in reality. Thank you for hearing.
Okay, thank you, Dr. Safi, for your very nice presentation. So actually we have now it's time for discussion. We have some question, but before we come to the question for Dr. Calvin and yeah, I think for Dr. Calvin, yeah, the question. So we want to, of course, to meet our Dai Senpai. Dr. Agustin Kusumayati is here. She is the president elected for Asia Pacific Academic Consortium of Public Health. Before, she is a former dean of the Public Health uh, Faculty, University of Indonesia, and now she is the University Secretary of University of Indonesia. So very proud for Hai to see this, right? So let's listen to Dr. Agustin, please.
And I wonder that, okay. So it's really nice to see you, so to see all of you. This is really a very lovely family reunion. So before I come to the, some ideas about our situation now, let me deliver the great greetings from the new family member, the granddaughter of Nakamura Sensei. Her name is Inara. Hello, everyone. Okay, so yeah, the question though actually is, are we ready to really start a new normal life? Because we are locked down ourselves. Our country refused to use the term lockdown, but we use another terminology, but actually it's the principle, it's a lockdown. So when we are talking about the time when we are ready to reopen our society, our campus, our life, to go back to the normal life, actually we have at least 3 questions should be answered. First is about where are we now in terms of the epidemiological situation of the disease. So I should congratulate our neighboring countries such as Malaysia, Cambodia, Vietnam, and Thailand, because those countries already have the curve of the disease, meaning that the disease already slowing down, it's already reducing. But the Philippines is still struggling with the pattern, and Indonesia is still decreasing, keep the higher and higher number of the cases. And if we see one of the measures to decide whether we are ready or not to reopen our activities is what we call as the effective reproduction rate. It is required that we have less than 1. So the countries such as India, Indonesia, Malaysia, and also Philippines, Singapore, we are still struggling with the reproduction rate. Thailand, to some extent, already can maintain under 1. So this is the situation in Indonesia. You can see that today we have new cases 973, and we have a confirmed cases 20,162, and then the death rate is quite high. We have about 6% death rate. So Indonesia, actually, if we see from this aspect, actually we cannot say that Indonesia is ready to reopen the lockdown. This is the repression rate of Indonesia is still above 1. But what happened actually after we apply what we call as a regional quarantine? It's not a national lockdown, it's regional lockdown actually. Based on several reasons, on the 6th of May, the government loosened the deregulation towards transportations. So starting at that day, so more and more people move from, especially from Jakarta to outside Jakarta, because this is also relating to our custom that during the Idul Fitri day, we go back to our home countries. So many people going outside the Jakarta. We have top 10 roads of the flight. And then also this is the mobility of the people. We can see that the mobility is going reduced, but once the transportation is available, then the mobility increase again. And then we have the case here. So they are in the top 10 province that have higher cases, starting from that we loosen the lockdown by providing transportation. So actually we are not ready yet. The second question is actually to have to be considered whether we start to reopen or normalize our life is how strong our healthcare system is. So the question is actually, how big is our COVID-19 iceberg? Because if we see the result of the testing, it's only the tip of the iceberg. If we see the case of Jakarta, for example, the confirmed positive case is 6,000 something. But actually the sensitivity of the PCR is only about 60 to 70%. So actually the confirmed positive case should be 8,000 to 9,000. That's the tip of the iceberg. So to estimate the total iceberg, we use the rapid diagnostic test, and we reveal in Jakarta 3.8% are reactive. It means that out of 10,000 million people in Indonesia, about 390,000 people are actually have infected by this COVID-19. And if we consider the sensitivity of the rapid diagnosis test, the best is about 60%. Actually, the real infected people in Indonesia is much more. It's about 560,000 people. So this is actually the iceberg. We cannot have any estimation for Indonesia. Why? Because, but we estimate it will be much higher because we have some delay due to specimen transportation, queuing of the specimen in the lab, availability of the test kits. It's not available in all parts of Indonesia. There is a Java and non-Java variation, and we do not have a national serological survey strategy. So we do not, to some extent, cannot have any estimation about the whole iceberg of the COVID-19 in Indonesia. This is a photo how specimens are queuing at our lab. And then about the healthcare services, the capacity, these are several things that we have to see about the emergency room with isolation facility, inpatient with isolation facility, ICU, and etc. So if we see the condition now, we are still have additional support for the current hospitals. A special hospital that built established by the government, because we have cases more than available beds at the existing hospital. So if we are looking at that situation, we can imagine that actually the capacity of healthcare services in Indonesia is not ready yet to to bear all the cases. And then we have to keep in our mind, if we loosen the lockdown, we start a new life, then new cases will be increased. So the healthcare should be ready for that. The third question is how reliable our surveillance system is. The principle of the test, treat, isolate. Many of our countries have problem in testing. We do not have enough facility. We do not have reliable laboratory facility that resulting quite low sensitivity, for example. And then the treatment is cannot appropriate. Many of the people with symptoms are asked to go back home and then doing voluntary isolation, which is very we cannot maintain the or ensure the quality of the mandatory isolations. So we have problem with this. The capacity and coverage of swab tests with PCR. We do not have a very clear serological survey strategy. We should have actually a serological survey strategy using a standardized rapid diagnostic test with adequate sample size and sampling size, doing it repeatedly, so we can monitor the prevalence. Without this survey, we cannot monitor the prevalence. And then the people mobility, we cannot, in the case of Indonesia, we cannot stay that long to maintain people stay at home. We start to provide transportation, and then people start to move again. So social distancing and physical distancing is very important. So these are the things that we have to see at the part of the surveillance system. So if we look at those three variables or conditions, then we can have a feeling, we can make a very evidence-based decision whether our country or our area is ready to quote-unquote unlock the lockdown. So these are the recommendation. First, what is the new normal? For me, the new normal is we as a human being stay together, live together with the virus of COVID-19. It means that if we stay together without interfering each other, it means that we should or we can control the disease. If we still cannot control the disease, it means that we cannot live together with the virus. The COVID-19 can be maintained as endemic in one area, but it's not become an epidemic in this area. So this is the one thing. The new normal means that we have new standards in various aspects of life, in daily activities, all things aiming to prevent COVID-19 transmission. For example, we have a new standard in mass transportation. We have a new standard in, let's say, in the campus standard classroom density, for example. Those are the new standards that we have to identify, and we have to set up that although we become more active in daily life, but we still can prevent the COVID-19 transmission. And I agree also that these all relating with behavior change. So we have to do a very serious specific intervention to modify predisposing, enabling, and reinforcing factors so that the people may follow the standard, and then the transmission can be prevented. So road to the normal life. The first thing is should be strengthened measures to prevent disease transmission, and focus on intervention at the upstream level, at the grassroots level. The Pak Baikuni Sang, they have the concept of perang akar rumput, the grassroots war against COVID-19. And then the second one, why we should really prevent the disease transmission and lower the number of cases, because we want to prevent higher national health expenditure due to higher number of COVID-19. Besides, because of this COVID-19 epidemic, we have to some extent neglected other diseases. For example, tuberculosis, HIV, immunizations, maternal health, because the people, they just do not want to come to the health facility to prevent themselves from transmission of the COVID-19. So if we cannot stop in a very short time, so we will have another health problems regarding with another diseases such as tuberculosis, HIV, and then another immunizable diseases. And then last but not least is to prevent human capital loss due to sickness and death. This is some example. If we try to calculate, is really, really very high human capital loss and very high expenditure, health expenditure due to cases. And then this is a data showing that activities of health services going down, slowing down. Everything is slowing down due to this epidemic. The other things that we have to do is to strengthen the healthcare capacity, both laboratory services and then hospital services also, and then strengthen surveillance system. This is very important. The principle of test, treat, isolate, and then apply national or sentinel serologic survey. This is very important also. And then we have to have a very clear phases to open the lockdown with a very clear criteria and protocols. So every decision should be evidence-based. So I think the other thing is preparation of the new campus. This is what we have already prepared for our campus, develop a new protocol for environmental safety and occupational health in the campus, and then apply blended learning method. We maintain using ICT, intensify the student-centered active learning, so we do not have to see them and then let them learn by themselves. And then the most important thing is new safety and preventive standard in teaching and learning. For example, the classroom density, use of specific protective devices in practical work. For example, clinical work at health facility, field work, internship. So we have to apply a new standard, and we have to provide all needed facility. And we do have financial problems. Many of our students have affected by the disease, by the epidemic, so that we have to provide support from them. So I think this is all I can share to all the audience. It's really nice to meet you all here. So I really hope that we can have more discussion and then share our ideas, our experience, and then have a new idea that we can develop for our country and our campus. Thank you. I return back to Tia.
Okay, thank you, Dr. Agustin. Thank you, Ibu. So it means that actually we can say that all the countries it's a link that we have the same problem actually with the things that new normal life will be implemented. So the challenge is almost the same in every country. That's right, Dr. Agustin. What do you think?
Sorry, I just look at the question and answer.
Yeah.
We have same problems, and
we have same problem because it seems that every presenter said that we face the challenge because the COVID-19. We have to live with the COVID-19.
Yeah.
All the countries actually have the same challenge to be a new normal life style. So what do you think that with the different facility, different culture to face that kind of problem?
The very different culture that relate to our behavior is the principle of social distancing and physical distancing. This is really the most, the most critical things that we have to know, and then we have to change the behavior of our people, because as a social, we are a social person, so we tend to stay together, especially those from Asia, for example. So we have to change these things. So when we are talking about our daily activities, many aspects should be deregulate and that apply new standard. For example, the mass transportation. If we see, for example, the commuter line in Jakarta area, Jabodetabek is very, very crowded. So we have to make a new standard and new negotiation because we cannot maintain that practice anymore. And then also other public transportation. And because we also want to prevent transmission, so in campus, for example, or in work working places, for example, we have also to maintain physical distancing. And I think it's really a big difference between the previous practice with the next practice. The second thing is the individual precautions, how we maintain our personal hygiene, how we apply a new standard. For Japanese, for example, using mask is nothing new, but for Indonesian, it's really new, using mask. And then also how the etiquette, if we want to cough or we want to sneeze, for example, this a new standard. In public places, a new sanitation standard of the toilets, because toilets is a very a place where transmission can happen. So we have to change also the standard. Maybe disinfection should be done regularly in the toilets. So many things have to be redesign so that our activities, we maintain our activities, but we also maintain the prevention of transmission. So that's the main changings of our daily life, how we can doing our activities but keep preventing the transmission of COVID-19.
Okay, thank you, Ibu Agustin. We have some question directly to Dr. Calvin, and I see that Dr. Calvin already answered, but there's a general question like from Ibu Ella Laila Sari. She said that the COVID-19 pandemic is not only medical and an economic crisis, but also a crisis of values and commitment. And she said, what is your suggestion for low middle countries which denial and slow reaction has already made due to barrier of leadership based on our culture? So it's the question, because maybe with your with Ibu Agustin explanation about what happened in Indonesia, so what we should do actually in this situation. Yeah, maybe yeah,
Calvin.
I will unmute. Okay. Okay.
Let me do it.
It's still muted, yeah. Okay.
Okay. Our learnings in the Philippines is basically we had the same issue as what has been raised by by the person here, Laisla Sari. We thought that we responded quite slow, especially since those actually the first few individuals who cases in the Philippines are actually Chinese having their vacation coming from Wuhan. And as you know, our president, our government has a very tight relationship with China. From an individual points of view, of course, it would be difficult to pressure the president or the government to have the lockdown, but it helps also to advocate on from our end, no, on the need of certain measures coming from the university or recommendations coming from the university. In the end, somehow it worked because most of the members of the IATF, or at least the advisory panel, is coming from the University of the Philippines. As I've answered here as well, the best way is to perhaps learn from the experiences of such countries who actually started the lockdown a lot earlier and promote social distancing. And the sooner we start with the lockdown, the sooner we address the concerns of social distancing, the sooner we will also be able to manage the virus. I think that's the best answer I could give.
So can I add something?
Yeah, please, Dr. Shafi.
Yes, I think as you know, as I said already, the health system now totally exposed how we should rethink. When we talk about a health system, many developing country thinking about is a doctor or nurse only, but that's not the case. Health system is well functioning. Health system should be a harmony where we can see out trained manpower along with well maintained infrastructure, reliable supply, funding in place, and also we call evidence based policy and cooperation. So how to do that? So once you think, you have to think two things together. One is the demand side and supply side. So we should address both together, side by side, not one is other. Like example, demand side. We just talk about the what do you call doctors or nurses. But why not we think about the expectation people are wanting from us? What kind of services, what kind of guideline we need to provide the patients or the clients or the community they are looking for. And instead of supply side, we are is the time to focus. There's nothing new that we need to decentralize, we need to decompose and devolution and privatization. Only government, only other big player cannot solve the problem. We need to decentralize these things. That is one thing. So having said that, this is the issue we need to remember in all settings. So the resource limited. So how to solve, how to move forward? We cannot only talk on the problem, but we need to talk about the solution. Solution is different fold. In first phase, you need to think about how to collaborate and start dialogue to accept, not in a denial. Number one. Number three, we learned from Nakawa Sensei many years ago that many countries, they think about the expansion of the services. So now expansion all is done. Now think about the quality and safety and efficiency. So we have all the infrastructure is ready, but are we ready to provide the good quality, good testing, good facility? Example, we have thousands of millions of doctor, but are we ready for test for technologists? So if the technician, the technologists who conduct the test, they cannot do properly, and all the result will be negative, is all the result will be positive, and people will be misguided, and treatment will be delayed, and serious disaster will happen. So you have to think in every sector. You have to promote research and development. Once you talk about the development, you have to have a evidence-based research, as Augustine mentioned rightly. So, but are we ready in many developing or middle income countries to promote the research? In Iran or in Egypt, many of my physicians, they come, they are talking to me. I also know from Bangladesh. So if we want to do research, you have to do your by own. So you are a physician, you have to spend your own money to the research. But that is difficult. So your own practice or family, and then you have to do your own. So we need to develop that culture. And Augustine is now president of Asia Pacific Universities. I think that will be very good tool. She can bring the number one agenda. If you want to develop, you need to do evidence-based research in each setting. So one system is not fit for all. Every country should have their own strategy, then it will happen. And then we need to think about the aging and maternal health child population. Aging population is getting older. They have a serious support our country. They fight, they did a war and so many things, development. Now we need to get back to them. That is, we should remember why you should support. And maternal child health. So Japan is the example. If you have a healthy baby, healthy mother, you develop much more quicker than anything else. So we need to emphasize those. And not the last one, but the important thing is regulatory mechanism, how fast we can do it. And you can see Canada made a very good decision within overnight, approved $107 billion. Easily, if you have a regular budgetary parliament, it would take a year, month and month to debate and actually going nothing. But you see, your intention, your commitment is honest, then it is possible. So impossible itself said, I am possible. If you split impossible, so anything possible if we intend to do good thing. So I think that is the important. Now we need to respect each other, we need to listen each other, and we need to move forward.
Okay, thank you, Dr. Safi. I want to come to the very important question, I think. This is the question about is the new normal means apply herd immunity in the country? So please, maybe
Yeah.
the
Okay,
speaker.
Tia, let me try to answer the question.
Okay.
About the new normal. The issue is about the herd immunity. We can we learn from many courses, many lectures that herd immunity can be only happen if about 80%, at least 80% of the population has infected by the diseases and cured. So that the people, they got infected and then they cured, so they have the immunity. 80% of the population. So if we see, let's say for the case of Indonesia, our population is 271 million. If 80% are infected, it means that 216 million are get infected. If 216 million infected, about, let's say, 15% need hospital services, hospitalized, so it will be 26 million people should be hospitalized. So I don't think that our healthcare facility can afford it. And now we have our death rate, case fatality rate now in Indonesia, it's about 6%. It means that out of 216 million people who got infected, about 13 million will be die. I think ethically it's not good. It's not allowed to do no intervention and then try to develop herd immunity in this way. We can develop herd immunity if we have vaccination, and then we can make quote unquote 80 to 90% at least from the population get infected by the vaccines. So it's okay. Since there is no vaccines and it is not reasonable to do a natural infection to get herd immunity, then we only have one option: prevent the disease. So new normal does not mean let's have herd immunity by allowing natural infection. No, no at all. Because our system, our health system will not be able to maintain the burden. The number of sick people, the number of people need hospital services, and the number of dead persons. So our human capital loss will be very, very, very high. And ethically, it is not allowed by our profession. So a new normal is a life with a new standard that can prevent transmission of COVID-19. We are not allowing COVID transmission naturally and then hoping a herd immunity. No, it will not happen. That's my question. That's my answer. Thank you. Yeah.
Thank you, Ibu Agustin. Is there any comment from other speakers with this issue? So it's not allowed, ethically it's not allowed in our profession, and it's not fair for the community also to have such kind of thinking. So I think it's also answered the question from Eka Puspitasari, how to educate the public so they understand. So it's not the correct information that we will let herd immunity to be happen in our country, right? So the key, the important key is prevention, only that. So the prevention, so how to prevent the disease with our new normal life. So it's a very, very, actually it's very easy if it's come to the community empowerment, right? So we have to balance everything now with our situation. I think all the country, Japan, think about economic, think about the public health, it's also Philippines, also the Canada. So we have, I think we face the same problem. So don't think about the other countries. Maybe some countries is really good at handling with this pandemic, but actually we are struggling with this issue. Actually, some question is already answered, and we already have run of time, but
No, just one thing, Mutia.
okay.
Dr. Kauri already mentioned, think this way is not somebody's problem, is our problem.
Mhm.
So every family, every community should think this way. It's not somebody's problem. It's not my neighbor's problem. It's our problem. So if
Our
we start the basic foundation from the home, if we follow the health guideline, and if we follow our the funny thing is we teaching people how to hand wash. We people training people how to basic hygiene maintain. It's not a rocket science. We should be doing these things. We are so much super thinker, think above the box, but we never think I need to wash my hand. I need to use mask like Japanese people. When I was Japan, I was so impressed. Oji-chan, Oba-chan, we are walking together. They have a mask, so it's very good. And but we forgot due to our go-go situation. That's why environment, the something try to control us. Hey, stop, and go on slowly but surely. So that's why family foundation, family education, family health education, health professional is the key. So then if we think about my family and other people think about their family, and we think about our friends and relatives, that's the way we will regain again. We will rise again together. So it's not somebody's problem. I will do what I need to do. Just don't follow the rule is not right.
Yeah.
So we need to just follow the health advice, authentic suggestions, not the social media, Facebook or something. We should follow the authentic guideline from the health professionals. In Canada, best example, health professional brief first and then politician brief later. So, but you see in Indonesia is different. So politician brief first, health professional in the evening. So I found this is the significance of the developing nations difference. That is the thinking. There's nothing wrong with that. They prefer, Prime Minister prefer what health official says. Based on this, everything will happen. The university is looking for what health official is saying. Then university president coming to every day. Okay, so health official said this, we have to follow this.
Okay.
See, that's the thing. So just follow the common sense. Everything will be normal.
Yeah, it's like our problem, not yeah.
I think Kaori-san is talk something.
Yeah.
And today we saw just the negative part of COVID-19, right? We are all talk about what we lost, what kind of opportunities we lost. But in this morning, I just talked with my student via Zoom, and she mentioned that she lost many opportunities for meeting with her friends or something like that. But she gained some opportunities to enhance communication with her families.
Mhm.
So somebody mentioned family education or something. So we lost many opportunities, but actually we gained some opportunities to disseminate, collect information or like that. So we can see both negative side and positive side. Then we will gather our experience. Then maybe we should analyze together sometimes. Then develop good model, good practice can be shared with many countries. Maybe we can develop a new project under Nakamura Sensei.
Okay.
Yeah, of course. One more thing that to meet with Augustine San is it took 15 years. So, but COVID made us easy to see her. She's smiling, she's talking to me. That's important. So, friendship, fellowship is important. So, COVID bring us together very quickly. Thank you, Baikuni, and thank you, Tia, to meet with Nakamura Sensei, Caroline, and Augustine right away. You see, this
Yeah,
is the
that's right.
beauty.
Without COVID-19, we couldn't
We
make
never.
the meeting
Maybe another
today.
5 years later in the convention, I will meet Augustine
Yeah,
in
yeah.
Indonesia. Otherwise, not. But now we can see now.
Yeah.
We
Yeah,
will
actually,
think about, yeah.
actually, we plan to meet
all good
in
things.
the Netherlands, but
Yeah.
it's
No.
postponed. And then now we meet here.
Yeah,
Yeah.
at home. Home to
Yeah.
home is better.
I think we have to regularly make like this occasion of Zoom to share each other. I think maybe 2 months or 3 months gitu, Mr. Safi or Bu Agustin.
Yeah.
So we can contact and maybe we can make a project under Dr. Safi Bhuyan.
Okay.
We'll do monthly basis. Maybe not a 3 hour, maybe 45 minutes. After 45 minutes, it's better. So we'll discuss and exchange our development. Now is the foundation first day. We get to know and update ourselves, and then we go for the next level. I think monthly or every semester, first and last, we can do it twice. Yeah, it's better.
Okay.
I like it.
It's good if the regular Zemi in Handai can
Yes.
be
So we
open online so that we can join.
Yeah.
Exactly.
And then we can make the proposal. We can mess up the proposal.
Yes, that's a good idea.
Right.
Good,
So-
good, good.
You know, now Kelvin, Augustine is the president of the Asia Pacific, and I'm the president of the Canadian Universities. Nakamura is the president of the WHO. We can do now many things actually.
Yeah.
Yeah.
Leading position, and Baikuni is the public health. So
Yeah.
professors, all we can do many good things now together. And please feel free to propose and suggest me anything we can do. I'm
Yeah.
open.
Okay.
Good idea, Mr. Safi.
Thank
We
you
have
very much.
good networking, Sensei as a president of WHO, and Bu Agustin APAC, and Kauri have a good position as a professor also, and also Calvin. Okay.
Okay, right. I think if we really want to more and more discuss about this topic, of course, but time is limited for we'll have another meeting. But I want to mention, I want to quote what Charles Darwin said, that it is not the strongest of the species that survive, nor the most intelligent that survive. It is the one that is most adaptable to change. So in this our pandemic COVID-19, we have to adapt with the situation. So I can say that from the west to the east, from the north to the south, we are all facing the pandemic COVID-19. It won't stop now. We don't know when it will come to the end, but one thing for sure, we need to fight. Yeah. Empower the community is one of the key. Strengthen our collaboration is also the key. And let us be the winner of this war, right? Okay. Thank you very much for Dr. Agustin, Dr. Safi, Dr. Calvin, and
Thank you.
Mizumoto and Dr. Baikuni. And also we have still many participants to listen to this webinar. Thank you so much for coming to this webinar. So I hope it can give you insight what happened to other country and what should we do to face the new normal life in a quickly way. Yeah. So the prevention is the key. So we can face this pandemic. So we can win if we want, right?
Yes.
Okay, thank you very much.
Thank you very much.
Nice. I'm happy to have you all here. Thank you very much.
Thank you. Thank you for
Okay,
everyone.
thank you very much.
And
See you again.
Tui, nice to meet you as well.
Thank you very much. Nice to see you.
My
Yeah.
apologies. I have a class in 2 minutes, so I'll catch up with you.
You can.
Calvin, we are still waiting your marriage invitation.
Bye.
Don't forget to invite us, ya, Calvin.
Bye.
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 Okay.
Okay, thank you. See you again.
Yeah, me too.
Calvin.
Yeah, okay.
Please send my best regard to Nini, to your son, your daughter.
Yes.
Okay.
If you are going to have an in-law, please let me know. Please let us know.
Not yet.
Okay, thank you very much. Yeah, I enjoyed. Yep.
Can you off the live so we can chat, because I don't want to share this personal to the people. You can stop the live and we can talk. Yeah.
Can you help us, Hila?
Yeah. You just stop the live so we can talk with Agustin. Yeah. Agustin is